It's a way to find out what people are dying of. And like a physical autopsy, it's an attempt to really understand the events surrounding the death. And our goal, of course, is to be able to prevent premature deaths. So understanding this is going to be some key information for understanding what we can do to improve global health. The verbal part is because it's an interview. And so the way it works is someone who's been trained in doing these kind of interviews will go find a family member or someone who has experience with the final illness of the deceased about 6 months after the event. There's an important balance about when you do it. So about 6 months after a death, interviewer will come to someone who has that memory and experience with the death and say, I'd like to ask you a few questions. We're trying to understand what happened to improve population health. And let's talk about the events and conditions surrounding that death. They're important because about 2 out of 3 deaths globally do not get a death certificate. So if a death happens in the United States, it's very likely going to have a death certificate. About 3 out of 4 of those death certificates will be able to really understand what went wrong in the death. But globally, 2 out of 3 deaths do not have that kind of basic information. Verbal autopsy is one of the best technologies that we have available for filling that gap. What the new software does is goes from the results of the interview to a computer-driven diagnosis of what the underlying cause of death was. Now, this is version 2.0. The old software did that too. And what the new software is doing that faster and more accurately, and a very exciting part for me, in a way where it can help the doctor or the user understand why it's made its choice. This is something that's coming to be known as explainable artificial intelligence. We don't just want to know the computer said it was a heart attack. We also want the computer to explain what made it think that. The fundamental challenge is for the computer to know when it doesn't know. That some number of times, maybe 20%, 30% of these verbal autopsies, are not going to have sufficient information to say pretty clearly the underlying cause was this or was that. And I want this algorithm to say, we don't know. In this case, with the information available, we cannot determine what was the underlying cause. This is something that is really an important challenge in data in general and in public health data in particular, that there are huge uncertainties here. And we do not want to come away with a technology saying, I know this and I know that, and be wrong about it. Mark Twain put it well. It's not the things you know that get you in trouble, it's the things you don't know that just ain't so. It's been very interesting to see this emerge as an important part of software for global public health. That people want to not just have the software free of charge so that they can run it and not hurt their budgets. They want it to be free in a much broader way. And they want to have the software available at the source code level, free and open source software, so that they can examine it and see how it's working and make sure that it's doing something that they really want to be using. This is a global public good, so what I really hope is that they'll take this to the next step. For me, looking ahead, I think the next step is what you might call human-computer interaction. That we do not stop at explainable artificial intelligence, where the computer makes a prediction, the computer says, here's why the prediction. Next, we want to bring human expertise into this decision so that the computer and the human can work together to identify what was the underlying cause of death.